This is 50,000 women recruited for an osteoporosis study looking at fracture risk, and we were particularly interested in the association between osteoarthritis and fracture. And what we showed is that people with osteoarthritis had a 40% increased risk of fracture, which was partially explained by an increased risk of falls. What was new is that the falls would explain the increased risk of fracture, whereas in other cohorts it hasn't explained it. Because in osteoporosis we use bone density as a predictor of fracture, and people with osteoarthritis have an increased bone density, and therefore should have a lower risk of fracture, but they have an increased risk of fracture, and therefore we were concerned that people were being falsely reassured by their increased bone density measurements. I think there are two things. Obviously, if the falls explain the increased risk of fracture, we need to work out why these people are falling and have public health interventions to reduce those risks of falls, both with physiotherapy, nutrition and help around the home. But we also need to worry about, when we do an osteoporosis estimation, to add in that osteoarthritis is an extra risk factor, and that to not be falsely reassured by their bone density measurement. The bone density measurement is a two-dimensional measure of a three-dimensional bone, and they have up to 8% increase in bone mineral density. But when you look at as a true volumetric density, as we've done in another cohort, their density is the same, they just have bigger bones. So actually their bone density isn't increased. Additionally, when they get osteoarthritis, they have increased rates of bone loss, which again is an independent risk factor for fracture. So I think the increased risk of fracture may be due to a combination of bone loss, but also because of their increased risk of falls. And I think particularly of adverse quality falls. I think it's not just the number of falls, it's they fall particularly badly. I think we need to pay more attention to pain relief, physical exercise, and support around the home in people with osteoarthritis. And I think immediately we just need to, when we assess their osteoporosis risk, we need to think that their bone density may be falsely reassuring. I think at the moment we just have to accept that, probably the risk is 50% greater than you really think it is. But that needs to be more formally quantified before we make any adjustments to kind of formal scoring systems. Now it should be just a little alarm bell at the back of your brain just saying this person's got a higher risk than I really think they have.
This is Carrie Walker reporting for Global Medical News Network.